If you do this one thing in nursing school, I guarantee you're going to improve on dosage calculations. And not just a little bit, because you're going to improve so much, you're going to start being excited when you see dosage calculations on exams because you know it's going to be like free points for you. And yes, this is true even if you think you're bad at math. Because I've been a professional nursing tutor for 15 years, and I'm going to tell you the pattern I see. Drop an emoji in the comments if you're guilty of this. Humans, when we feel like we're bad at something, we want to avoid it. When it's something we have to do, it's called procrastination. When it's related to dosage calculations, it becomes a self-fulfilling prophecy. That is why the tip I'm about to give you will not work unless you trust the process and actually do it. And I'm even going to give you 2 detailed ways that you can do it so you can pick the one that fits best for your situation. So here's the one thing you have to do to be successful at dosage calculations. Follow a practice plan. I've got 2 non-overwhelming practice plans you can follow. And I guarantee you that if you follow them the way that I explain, you will improve on your dosage calculations. Let me tell you why real quick, because it's so important that you trust this process, otherwise you'll never stick to them. And then I'll tell you the practice plans. They work because they force you to break this negative cycle of avoiding the practice that's going to get you to success. What most nursing students do is when you have a dosage calculations exam coming up, you try to cram and practice dosage calculations like within a few days of your test. And then as soon as the test is done, maybe you pass, maybe you don't. But if you do pass, you just stop doing dosage calculations. What this tells your brain is that dosage calculations are not important. Our brain is brilliant and it's also efficient. So if we spend time training our neurons how to do dosage calculations only to completely stop doing them after your test, your brain's going to be like, oh, we thought that these neuron connections were important, but I guess they're not because we're not using them anymore. So we're going to get rid of them. But guess what? You're going to have to do dosage calculations again someday. You do not want to waste all the hard work you just did by letting your brain get rid of those neural connections. So you have to have a practice plan that's going to establish those neural connections permanently. And then dosage calculations becomes like riding a bike. You know the old saying, once you know how to ride a bike, you never forget. And it's true. Also with dosage calculations. So here's the 2 practice plans you can use to get to that point of dosage calculations mastery. One is called the CRAM plan. And this is literally the only time as a professional nursing tutor I ever recommend cramming. You can choose it if you just want to like get it out of the way, but also if you have a dosage calculations test coming up within the next week or so, definitely choose this one. The CRAM plan requires you to choose a big block of time, like 3 to 6 hours, and just do practice question after practice question after practice question after practice question. Now you have to do your practice questions a very specific way, which I'm going to tell you right now. And this is going to be the same for both practice plans. For each individual practice question, first you're going to just do it on one single page. Keep yourself organized. You're going to solve the problem using your preferred method. And if you need a preferred method, like the one you're using isn't working for you, I have a solution for you, but I'll tell you about that at the end of the video. After you solve the problem, you check your answer. If you get the question correct, put a smiley face in the upper right-hand corner of your page. This is important because as a nurse, you're going to be documenting. You are documenting your progress by doing this. If you get the question wrong, you're going to figure out where you went wrong, figure out what you need to do differently next time to get it correct. But don't leave it there. Now you go back and you redo that problem from scratch and try to get it correct. If you get it correct on your second try, then in the upper right-hand corner, you put a 2 because it took you 2 attempts to get that question correct. And here's the thing. When you get it wrong, celebrate because I want you to get things wrong when you're practicing. Let's get all the mistakes out of the way when you're practicing so when you get to your exam, you have dosage calculations mastery. Getting things wrong is good when you're practicing. If it takes you 3 attempts, you put a 3 in the upper right-hand corner. Anyway, once you get the question right, you go on to the next question on a brand new page so you can document in the upper right-hand corner. For the CRAM plan, for that initial 3 to 6 hour dosage calculation session, you're going to just do question after question after question using that process. And you do it until things start to click for you. Until you feel like you're getting more correct on the first try than you are getting wrong. But you don't stop practicing then. Because remember, we are training your neurons that this is important and you never want to forget it. So you also have to do some long-term practice, but we're going to keep it really easy because I know you're stressed out from nursing school. We don't want it to take up too much of your time. So after you finish your 3 to 6 hour CRAM session, you're going to plan to solve 1 to 2 dosage calculation questions per day, 3 to 5 days per week. It should really only take you about, 15 minutes a day for those 3 to 5 days per week. It's not a ton of time each week, but it's enough to remind your brain, hey, this is important. Make sure you remember it. Continue that long-term practice plan for at least a month. At the end of the month, you just ask yourself, do I feel like I'm gonna never forget this? Do I feel 100% confident? If the answer is yes, you get to quit practicing now because you're gonna be fine. If the answer is no or you're not sure, just continue that long-term practice plan of 1 to 2 dosage calculations per day, 3 to 5 days per week for like another month or so. Do not skip the long-term practice. Do not skip putting each individual question on its own page and documenting even when you're doing the long-term practice. This is going to give you valuable information and save you time because number one, you're probably not doing as bad as you think. And when you start seeing all the smiley faces on the pages, it's going to make you feel good. And the second reason is because the questions you're getting wrong are probably a specific problem type. Like maybe you're not having trouble identifying how many pills are you supposed to give. So stop wasting your time practicing those kind of problems. Focus on the problems you're having the most difficulty with. I'll tell you right now, it's probably going to be the weight-based calculations. The second practice plan option is the 30-day method. This is great if you're still pre-nursing and haven't started classes yet, or if you just have a month or more before your next dosage calculations exam. It's similar to the long-term practice plan that comes at the end of the cram plan, but we do have to do a little bit more because we didn't start with that cram session. So the 30-day plan requires you to do 2 to 3 dosage calculations per day, 5 to 7 days per week. And even this is not going to take you a ton of time, maybe like about 20 minutes a day on average. So 2 to 3 questions per day, 5 to 7 days per week for the 30-day practice plan. And you're still got your notebook, you're still doing the problems 1 page at a time and documenting how many attempts it takes you to get it correct. At the end of 30 days, you ask yourself the same question. Do I feel 100% confident or am I still a little bit unsure? If you're still a little bit unsure, continue for another 30 days. But I guarantee if you follow one of these 2 practice plans, you're going to become a dosage calculations master. I can't even tell you how many students I've worked with who learn my method for dosage calculations and follow one of these practice plans, and they turn from swearing that they are allergic to math to complaining because all of their classmates keep asking them to tutor them in dosage calculations. It's a good problem to have at that point. Now, if you're saying, Nicole, the practice plans sound great, but I don't even know how to solve dosage calculations in the first place. Well, I help students with that too, because it's true. These practice plans work best if you have a reliable method to use to solve dosage calculations. I have my very specific way of teaching it, and most people who come to me, they start out using the formula method, which I hate. Now, if you use the formula method and it's working for you and you feel 100% confident, don't change what ain't broke. But if you're watching this video, I'm guessing that it's not working for you 100% at the time. And I have a way of teaching nursing students how to do dosage calculations that makes the math super simple. It's basically if you can multiply numbers across the top, multiply numbers across the bottom, and then divide 2 numbers, that's all the math you have to do. Because the dirty little secret of dosage calculations is that it's not the math. The problem is how to set up the problem. But once you have a reliable way for knowing how to set up the problem, no matter how complicated or how many extra pieces of information they throw in there to try to trick you, then dosage calculations becomes more like a fun puzzle than something to dread. So if you got more questions about the way I teach students to do dosage calculations so that they become guaranteed points on all of your nursing exams, and you're watching this video in a place where you can leave a comment and ask me. I'll do my best to answer. If you're watching this video in a place where you can't leave comments, you can always find me at my website at www.yournursingtutor.com. That's also where you can get information on the best ways to work with me so that you can master dosage calculations for yourself. Because I know this can feel overwhelming. You are not the only one who feels that way. And I know how frustrating it can feel when you've always felt bad at math, and now it's the thing standing between you and your nursing dreams. But it doesn't have to be. I have literally helped thousands of nursing students move from feeling allergic to math to actually enjoying solving dosage calculations. And believe it or not, but that can be you too. Don't forget to join my email list and get your free dosage calculations practice plan. That also includes a bonus chart with the most common conversion factors you have to memorize. Here's to your nursing school success. And as always, good luck on your nursing school journey.